Ever pondered the meticulous process that athletes follow to bounce back from an ankle injury? Well, it all starts with a comprehensive evaluation, followed by a structured rehabilitation program. The evaluation of an ankle injury kicks off with history taking, where the circumstances of the injury are explored, along with the athlete's previous injuries and level of function before the injury. A visual inspection follows next, with a keen eye for swelling, bruising, and any deformity. Palpation helps identify tender areas and pinpoint injured structures. Next up is a range of motion assessment, which evaluates the ankle's movement capabilities to gauge the severity of the injury. Manual muscle testing follows, assessing the strength of the muscles around the ankle and checking for pain during muscle contraction. A neurovascular assessment is paramount, ensuring there's no nerve or vascular damage by checking sensation and blood flow. Ligamentous testing, which includes specific tests like the anterior drawer test, talar tilt test, and Kliger's test, is performed to assess the integrity of the ankle ligaments. Functional tests observe the athlete's ability to walk, hop, or squat, evaluating how the ankle handles weight-bearing and movement. If a fracture or severe ligament tear is suspected, imaging such as X-rays, MRI, or CT scans may be ordered. The culmination of these steps leads to a diagnosis and, if necessary, a referral to a specialist for further management. Once the evaluation is complete, the rehabilitation process commences. The RICE method, rest, ice, compression, and elevation, is recommended initially to reduce swelling and pain. As the pain subsides, range of motion exercises are introduced, starting with gentle movements like tracing the alphabet with your toe. As progress is made, strengthening exercises are introduced to fortify the muscles around the ankle. Proprioceptive training, or balance and coordination exercises, are then engaged to prevent future injuries. Sport-specific activities are also incorporated to ensure the ankle can handle the stress. The final step is a series of tests to determine if the athlete is ready to return to sports safely. It's important to remember that this process is designed to ensure a safe and effective recovery, but it's essential to follow the guidance of healthcare professionals throughout. The specific protocols may vary depending on the sports medicine facility and the nature of the injury. Always consult with a healthcare professional for an accurate diagnosis and treatment plan. So, the next time you witness an athlete spring back from an ankle injury, you now know the rigorous and systematic process they've journeyed through, from evaluation to rehabilitation. It's a testament to their resilience and the power of a well-structured recovery plan.